This is a next-generation case study, pharmacology edition, and it is brutal. One patient, 6 steps. The trap is a lab value that looks perfectly normal. Read every number across the days. A 78-year-old has heart failure and atrial fibrillation and has taken digoxin every day for 2 years without a problem. 2 weeks ago, the water pill, furosemide, was increased to bring down some ankle swelling, and no potassium was added. This morning, he has nausea, no appetite, and 3 days of feeling very tired. He says the lights have yellow-green halos, and his vision is blurry, and his daughter says he is more confused than usual. His pulse is slow and irregular, about 48. The one thing going well, the ankle swelling is much better. Now the numbers, and read them across the days. The potassium was 4.1 at baseline, then 3.4, and today 2.9. That is low and falling since the water pill went up. The digoxin level today is 1.8, which sits inside the reported therapeutic range of 0.5 to 2. The magnesium has drifted down to 1.4, and the creatinine has crept up to 1.5. Hold on to that potassium. Step 1, recognize cues. For each finding, decide expected for stable heart failure or needs follow-up. Take a moment and make your picks. 6 of these need follow-up. The slow heart at 48, the yellow-green halos, the nausea and lost appetite, the new confusion, the potassium of 2.9, and yes, the digoxin level of 1.8. That in range level is the trap, because it does not rule out toxicity when the potassium is low. The better swelling and the stable blood pressure are the parts going well, and that is what makes the toxicity easy to miss. Step 2, analyze cues. What is causing these symptoms? Why is it toxic at an in-range level? And where did the low potassium come from? Take a moment and choose each blank. This is digoxin toxicity, even though the level reads in range. It is toxic at this level because a low potassium makes the heart more sensitive to digoxin. And the low potassium came from the increased loop diuretic, with no potassium replacement, which dropped it from 4.1 to 2.9. The digoxin did not lower the potassium. The water pill did. Step 3, prioritize hypotheses. Which single explanation ties the slow heart, the visual changes, and the low potassium together? Take a moment and pick one. One chain explains all of it. The diuretic dropped the potassium, the low potassium made the digoxin toxic, and the toxicity produced the slow heart, the halos, and the nausea. Worsening heart failure does not cause halos, and the swelling is better. A stroke would not explain the nausea, the slow heart, or the potassium. Prefer the single explanation that covers everything. Step 4, generate solutions. Which interventions should the nurse anticipate? Select all that apply. Take a moment and choose every action that fits. Hold the digoxin. Hold the loop diuretic and replace the potassium carefully, with monitoring, because correcting the potassium is what makes the digoxin less toxic. Replace the magnesium too, since it is also low, and the potassium will not stay up without it. Put the client on continuous cardiac monitoring and count the apical pulse for a full minute, holding the digoxin for a rate under 60, and anticipate digoxin immune fab if the toxicity becomes life-threatening. Do not give the next dose because the level is only 1.8, that is the trap. Do not give calcium, and do not restrict the potassium, it is already low. Step 5, take action. Put these 6 actions in the order you would carry them out. Take a moment and sequence them. First, hold the digoxin and the water pill, which needs no order and stops adding to the problem. Second, put him on a cardiac monitor and take a full set of vitals because the slow heart is the immediate danger. Third, notify the provider with the heart rate, the potassium, and the symptoms. Fourth, give the potassium and magnesium replacement per order on the monitor. Fifth, Keep digoxin immune fab available in case the rhythm gets worse. And sixth, recheck the potassium, the digoxin level, and the heart rhythm. Step 6. Evaluate outcomes 3 days later. For each finding, improved or not improved, take a moment and decide. Improved, the potassium back to 4.0, the heart rate up to 66 and more regular. The halo's gone with the appetite returning, and the magnesium corrected. Not improved, the loop diuretic was restarted at the higher dose with no potassium replacement, which rebuilds the exact setup that caused this. The client feeling better is welcome but not measurable. And there is no potassium supplement on the discharge list, which is the gap that sends him right back. So here is the whole case in one line. Nausea, halos, and a slow heart on digoxin is toxicity, even when the level looks normal because digoxin has a narrow safety margin and a low potassium makes it dangerous. And know the contrast for the exam. This chronic picture runs a low potassium from the diuretic, but an acute toxicity runs a high potassium instead. Hold the digoxin, count the apical pulse for a full minute, and correct the potassium and the magnesium. That's the NCLEX style. Save this one and follow for the next. Happy studying.